The recent World Health Organization alert over risks from 4 cough syrups blamed for the death of 66 children in the Gambia has created panic among Indian parents. Dr. Abhijit Bagde, paediatrician at Apollo Hospitals, advises on protocols involving medicines for children.
All these medicines are safe. However, one has to be appropriate and right about the location of the problem and what kind of problem it is. So I would say, especially for population less than 2 years of age, when a child cannot communicate what kind of problem he or she is into, then best way is to get the child examined by a pediatrician and then going for the appropriate medicines.
Before medicines come into the market, extensive safety trials are done. Serious side effects due to the cough syrup use are very rare. The current panic is based on this development from the Gambia. The medicines in question are not available or intended for the Indian market. The World Health Organization has put out a precautionary note, but it is still being understood whether there was a causal relationship between the chemicals and the deaths. One of the things possible is that 2 other chemicals in the medicine were in higher proportion. Panic as a reaction is understandable, but it shouldn't erode trust in doctors and treatment methods in India. One should remember that physicians give the same medicine to their own families and to their children. Diagnosing the cause and site of cough is vital, is what doctors say.
Now let's understand what is this cough. Cough reflex is a protective reflex which is initiated by many locations. It can be a throat infection, it can be coming from throat like a throat infection, it can be coming from a voice box because of irritation or infection, it can be coming from airways in the lung like asthma, it can be a foreign body stuck in the airways, or it can be coming directly from the lung, typically bacterial pneumonia.
One should not blindly take cough syrup for relief. Like with all medicines, cough syrups have to be given on the basis of the problem. Most commonly prescribed cough syrups are antihistamines, which are safe for all ages. The second class of drugs is cough suppressants, which are not recommended for children under the age of 2. However, they can be given in case of emergency. They aren't recommended, but one doesn't see major complications with their use. Both these medicines are easily available OTC. They don't really cure the infection. Now, aside from symptomatic relief, it is important to treat the actual infection or irritant causing the cough reflex. Simply having cough syrup to reduce coughing will not cure the root of the problem.
If we are looking at a bacterial infection, we have to use antibiotics. If we are looking at chest congestion, we may have to use bronchodilator orally or in the form of nebulizations. If it is infection and inflammation of voice box, then different kinds of nebulization or even low dose steroids can be used. And if it is related to mild throat infection, then generally we use only symptomatic relievers like a nasal drops or maybe a cough cold serum.
It is important that medicines be taken correctly based on a doctor's prescription. Also, the prescribed medicines should not be stopped abruptly and the entire course should be completed.
For more informative videos like this, keep watching India Today Newsmo.